Since the 1960s, the standard of care for most cancers has been systemic chemotherapy. By flooding the entire body with these highly toxic medicines, cancer may be held at bay or even beaten, but the toll it takes on a patient's body can be severe. This systemic approach can cause a number of symptoms, such as nausea, fatigue, hair loss, but more concernedly, damaged organs, and even reductions in patients' immune systems, which can lead to life-threatening infections. These side effects are so severe that more than 30% of patients who receive chemotherapy are forced to reduce their treatment or stop entirely. For those who can tolerate chemotherapy, they will have to go to the specialist clinic to get their treatment. In some regimens, this can be weekly. Despite decades of progress developing better, smarter, and stronger chemotherapies, the methods of delivery have largely remained stagnant. It remains systemic. We at BioSapien believe that localized tumors deserve a localized solution. Using our MediChip platform, we take the fight straight to the cancer while sparing the rest of the body. Over the course of 1 month, our biodegradable drug platform will deliver localized chemotherapy directly onto the tumor. In doing so, we hope to reduce the amount of chemotherapy needed, reduce or eliminate systemic side effects, and enhance the standard of care for all patients. The future of medicine is not broad and systemic. It's directed and personalized. BioSapien is leading the charge on a more localized standard of cancer care, one that minimizes the terrible side effects of chemotherapy on healthy tissues. Our initial submission to the FDA is focused on lower GI cancers, a condition that will affect more than 151,000 Americans this year alone and is the second most common cause of cancer deaths in the US. BioSapien is committed to developing a better way to deliver chemotherapy, but we can't do it alone. We need your help to fight this disease. If you would like to know more, please visit us at biosapien.com. Together, we can treat cancer locally.